Hello everyone, my name is Kira Baker and today we're going to be presenting the clinical case study of LC. Today we're going to be going over a couple things with LC. We're going to be going over just an introduction of LC, why she's here, the state she's in currently. We're going to be going through the pathosociology. Pretty much that's going to go over kind of the symptoms and how they connect with her diagnosis. We're also going to go through a nutrition care plan is how I'm going to organize this as like an assessment, diagnosis, and intervention. And we're going to also go through the conclusion and final thoughts. So the first thing I want to do is the introduction. So LC is a 32-year-old female. Her diagnoses are as follows. Her primary is hantavirus pulmonary syndrome, valley fever, small bowel obstruction, second to ascariasis, which is also a worm as well. And the secondary is a profound protein calorie malnutrition. So as for the introduction for LC, again, she's a 32-year-old female. She's an English archaeologist / treasure hunter who is working in Mexico's Yucatan Peninsula, which is a pretty cool career. Unfortunately, she came into the Texas Medical Center after experiencing abdominal distension, poor appetite, 16-pound weight loss, nausea, worsening epigastric pain, and onset vomiting for about 3 months. And then developing headaches, a cough, diarrhea, fever, night sweats, a rash on her legs, and general malaise. So Elsie's condition deteriorated once getting to the Texas Medical Center, and she developed hypotension and pulmonary edema, requiring her to be intubated and placed on medical ventilation in the intensive care unit. A nasogastric tube was placed for decompression, and a central line was placed for total perinatal nutrition. So these definitely do not sound great, but definitely she was placed under that care. And we're going to discuss the pathosociology of her condition. Pretty much we're going to discuss the symptoms and the connection to the diagnosis and why they occur. So the symptoms and the pathosociology, I kind of shortened it out. So for the symptoms of the hantavirus, it's going to be the flu, nausea, vomiting, thrombocytopenia, dizziness, and dyspnea without a cough. For the pathosociology, the virus enters the body. As it enters the body, it replicates and it spreads. So pretty much it's going to enter the body in some sort of way, and pretty much it's going to replicate throughout the body, those virus cells, and it's going to spread throughout in different organs. It can get a lot worse if it spreads too far. If it's cured at a certain point, it can definitely be helped, but it is a deadly virus. As for valley fever, it can cause fatigue, cough, fever, shortness of breath, headache, night sweats, muscle aches or joint pain, and rash on upper body or legs. So these are fungal spores. These fungal spores infect the lungs and can spread. So when these fungal spores spread, it's pretty much kind of the same as the hantavirus, where they can spread. They can start in one place and then spread throughout the body and infect different organs. Again, the valley fever can be a deadly virus if not treated and early. Next is a small obstruction, second to ascariasis or the roundworm. So it can cause abdominal pain, nausea, vomiting, and poor appetite. A larvae, kind of like a worm, pretty much. It enters the body and travels, and again, it enters the body in certain pathways and travels through the body until it reaches the intestines. As for the protein profound calorie malnutrition, it can cause apathy, irritability, weakness, cognition impairment, diarrhea, balance by so pretty much what happens with protein calorie malnutrition is it causes a negative nitrogen balance. So this negative nitrogen balance is caused by the malnutrition, and what happens after that is it tries to use the protein from other sources, such as like the protein that's already in the body, pretty much like the liver and the muscles, for energy once the adipose tissue depletes. So once the tissue is depleted, it tries to take the protein away from other muscles that it's needed to be at, which can cause the malnutrition in the body. So next we're going to go over the nutrition care plan, as is discussed before, the assessment, the diagnosis, as well as the intervention. So we're starting with the assessment, the food and nutrition related history. She is on a strict vegan diet, and she has had a nutrition history of vitamin B12 and D deficiency. So she does take vitamin D medication. We do, of course, want to recommend her to go out in the sun more. She does work in caves and caverns looking for treasures, so it definitely can increase the vitamin D, even without just the supplementation and medication she's already taking. As for vitamin B12, as a vegan myself, I know vitamin B12 is a vitamin that vegans are very low in commonly because it's mostly found in animal products. As for that, increasing that vitamin, it will be crucial, and we'll discuss that in later slides. As for the anthropometrics, the height is 175 centimeters or 5'9". The weight is 53.6 kilograms or 118 pounds. The BMI is 17.4 kilograms, which makes her in the underweight category, under 18. And the usual body weight is 61 kilograms or 134 pounds. The nutrition-focused findings, roundworm was found, and that's the small bowel with the scarsus. The roundworm was found in the intestines, which may have infected the absorption and digestion in the small intestine. A procedure known as a small bowel resection must occur. So this must occur to pretty much remove parts of the bowel that we will discuss in the next slide. And pretty much the client medical history. As for that, we're basically going to focus on 3 different things that I saw that kind of relate a lot to how they deplete nutrients, and that includes Crohn's disease. So Crohn's disease is connected a lot to malnutrition of specific nutrients because some nutrients can cause flare-ups. As for hypothyroidism, it can cause issues with specific nutrients, especially iodine. If you have too much iodine for hyperthyroidism, then it can increase and cause flares for the thyroid. As for pancreatitis, it can cause an inflamed pancreas that may not produce enough digestive enzymes to help absorb nutrients from food. So pretty much what happens is the pancreas can inflame, and this is kind of another flare-up that occurs. And with this flare-up, what happens if it can't produce enough digestive enzymes is what it does is there's not enough digestive enzymes to digest the food. It's not going to properly digest, and this can cause constipation, this can cause bowel issues, all sorts of things when it comes to digestion. Next, we're going to talk about what organs are affected. So as for the affected organs for each of the diagnosis, we're going to start with Hater virus, which affects the lungs. So pretty much it affects the lungs at first. It usually starts by like a fever, cough, pretty much simple symptoms that you wouldn't expect to be connected to this. And then it starts to affect the lungs. It affects the lungs by filling them up with fluids, and it can spread through the bloodstream and other organs such as the heart and kidneys. As for valley fever, it causes an infection primarily in the lungs as well, and can infect other organs such as the central nervous system, brain and spinal cord mostly, skin, bones, and joints. As for the small bowel obstruction, second to Ascarsis, it has the larvae, as we discussed before, that spread throughout the bloodstream, begin in the lungs, and move to the trachea, where they are swallowed and move to the intestines. If uninterrupted, lead to small bowel obstruction. So the small bowel obstruction can be caused by this as well, and this is one of the main issues that we'll discuss later on. But pretty much the larvae can cause this. It can move in different areas, but it's mostly trying to get to that small intestine because it's going to infect that the most. As for profound protein calorie malnutrition, it affects organs that can cause organ weight decrease. So pretty much it decreases the amount of weight in the organs, which also can decrease their overall functions. And it is the greatest in the liver, so it occurs more in the liver than any other part. It's intermediate or occurs kind of in the middle in the heart and kidneys, and the least amount occurs in the nervous system. We're going to discuss nutrition implications. So the nutrition implications mostly refer to the surgery we discussed before, the small bowel resection. And pretty much what happened to LC is she is going to have a duodenum and the jejunum removed. So pretty much only part of the jejunum and all of the duodenum. She's going to get 22 centimeters of the duodenum removed, and then the proximal portion of the jejunum measured at 100 centimeters. The removal of these can cause a lot of digestive issues because with the duodenum, that is the first step into absorption. It's pretty much finishing up that last bit of breakdown in chemical digestion, which allows the body to kind of absorb the nutrients. So it starts to absorb a couple nutrients there, and then moving to the jejunum, it continues the process. It can lead to reduced capacity of food because you can't absorb it as much, so it's not finishing the digestive process, and it won't allow the absorption to occur, which can cause malnutrition. It can cause issues with nutrients, etc. And then a liquid or tube feeding is necessary after procedure until the bowel works again. And then the diagnosis, the PES, the traditional diagnosis. The PES statement is involuntary weight loss related to profound protein calorie malnutrition, as we saw that can cause weight loss, small bowel obstruction, second-to escarsis. The strict vegan diet can also cause weight loss depending on how strict the vegan diet is and how much she is eating. Evidenced by the development of poor appetite, nausea, onset vomiting, roundworm found in the intestines, diarrhea, abdominal distension, and 16-pound weight loss in only 3 months. As for the intervention, the nutritional intervention, she's going to be put on enteral tube feeding, and food trials will be initiated with speech language pathology to reintroduce solid foods once she is off the tube feeding. She will need to understand a lot getting out of the hospital, especially when it comes to eating habits. She's going to have to take it slow. Definitely, the bowels are going to continue to heal and find ways to function without the duodenum and part of the jejunum. So eating slower is crucial. Trying not to rush back into solid foods, trying to start off with a little bit of liquids, slowly start into soft foods, and then get back into solid foods. As for the recommendations, LC needs an increase in protein intake, thinking about her protein calorie malnutrition. Supplementation, I include vitamin B12 and vitamin D. She doesn't need as much supplementation as she does mostly to go outside and to be able to get some sunlight for natural vitamin D, and to increase her caloric intake to get back to an appropriate weight she needs for her height. And the intervention for enteral tube feeding. So the options were Jevity, Juven, Vital, and Promote. So unfortunately, these all contain milk products. So with that, we do recommend the Complete 1.4 Nestle plant-based formula. This is a vegan formula that's going to provide what she needs in nutrients, and also is going to adhere to her vegan diet. I don't want to provide her with anything that's not going to adhere to what she wants, and we want to adhere obviously to the diet that she is currently on. And just in case anything occurs, like sometimes in vegans, with not eating a lot of dairy dairy can definitely affect the body if you're just randomly starting to put it in. So definitely making sure to adhere to that vegan diet just in case some negative effects occur. And then the product has 72 grams of protein. It has 1,400 calories and 776 grams per milliliter of fluids per 1,000 milliliter serving. These are going to match LC's caloric needs, as we can see here. So pretty much for her caloric needs, the protein is between 64 and 107 grams per kilograms per day. That can be increased and adjusted. That's kind of just an estimate of what she needs. As for the fluids, definitely 1,073 milliliters per hour fluid bolus. And as for the calories, 2,258 with that caloric increase. For the volume of feeding, she's going to need 1,613 milliliters a day. The calories she's going to intake is 2,258. She's going to intake a little bit more protein and fluids, which is okay because it can help with the profound protein calorie malnutrition, and can also help with the weight gain as well. It can also help increase those fluids, as she's probably flushed from those fluids from the nausea and vomiting and all the stuff that was going out of her body, the diarrhea as well. And additional water flushes will be 60 milliliters every 4 hours. So just to conclude, we definitely discussed a lot about LC. She has a career as an archaeologist. She definitely needs to increase her vitamin B12 D intake, increase protein and caloric intake, and just ensure she's following, making sure that her vegan diet's lining with what she needs. With these nutrition additions to LC's diet, she can recover and gradually regain the weight she's lost. All right, I would like to thank you guys so much for listening to this presentation. Here are my references for the presentation, and thank you so much for listening, and hopefully we can help Elsie get to where she needs to be. Thank you and have a great day.